Hello and welcome to Module 1, Lesson 1 of the Digital Health Technologies course. In this lesson, we'll look at the big question of what is health information technology. The Digital Health course is a program of the Grow Behavioral Health Workforce program of the Center for Health Innovation. Learning objectives for this lesson. Students who successfully complete this lesson will be able to define health information technology, or HIT, identify potential benefits of HIT, and identify 8 types of technology used in healthcare. Keywords for this lesson include health information technology and its abbreviation HIT, and the High-Tech Act. Here's what we'll cover and in what order. First, an introduction to technology in healthcare. Second, we'll define health information technology. Third, we'll look at who's in charge. Fourth, we'll examine 8 information technology tools. We'll conclude with a lesson summary, and don't forget to complete the quiz at the end of the lesson to check your understanding so you can move on to the next lesson. Introduction: Technology in Healthcare. Just as technology shapes our lives, it is reshaping healthcare. If you think for a moment about how different a phone call is for you, if you even place them, you may just use text, than it might have been for your grandmother or your great-grandmother, for whom it might have been exciting to be able to even pick up a phone, who might have used an operator to help place a long-distance call. Now you can text or call someone in any corner of the globe. As a behavioral health paraprofessional, technologies will impact your job, just as they've impacted your personal life. You'll be using common digital tools like word processors, spreadsheets, email, and other tools that are commonplace throughout multiple industries. However, those tools are not the topic of this course. If you're not comfortable using them, please refer to the resource guide in the course overview for digital literacy courses and training, available both online and locally. The topic of this course is specifically digital tools designed for healthcare. We'll look at the what, the why, and the how of those tools. First, a definition of health information technology. Health information technology is the electronic systems healthcare professionals and increasingly patients use to store, share, and analyze health information. It includes the hardware, software, and electronic environment used to collect, process, and analyze data. Used appropriately, health information technology has the potential to improve quality and timeliness of care, increase care coordination, improve patient outcomes, reduce costs, and increase patient satisfaction. Outside of the clinic as well, new technologies are transforming the way that support is delivered. New technologies are helping healthcare workers to reach patients, clients, and community members. They're providing more effective and efficient ways to communicate, engage, and educate with patients, clients, and the community. I want to remind you that in addition to watching this video, you should be sure to read the lesson that's included in this module. And some of the lesson content we'll cover here, but there will be a little bit that's not covered. So you are expected to read that. In the lesson, some of the things that you'll find more fully fleshed out are the discussion of who's in charge. That includes the role of the Office of the National Coordinator of Health IT. I will touch on that briefly here, but please refer to the lesson for a little more information. Secondly, you'll also find a brief overview of the recent history of health information technology and its regulation. And you'll find a similar discussion of the common tools in today's behavioral health clinics and their uses, as I will cover here. Who's in charge? The development and use of health information technology in the United States is overseen by the U.S. Department of Health and Human Services Office of the National Coordinator for Health IT, referred to by those in the field as the ONC. The ONC provides a whole host of resources for clinics and for IT professionals. It provides technical support for employers who are implementing or putting in place health information technology tools. It also provides for voluntary certification of those tools. That means that if you are an information technology developer and you want your tool to be certified and recognized as a valid one that can be used by clinics, you can go to the ONC and the ONC can give you its stamp of approval. And finally, the ONC is in charge of the coordination of the rollout of health information technology across the nation. This is a rollout that has been going on for many years, at least 10 to 15, probably closer to 20, that we started to see electronic health records and electronic medical records start to move into the healthcare workspace. And the ONC continues to coordinate that to assure that all clinics, public and private, have access to this technology so they can improve the care that they deliver. Uniquely, the ONC works closely with both public and private sectors to develop and implement strategies to advance health IT and information use. The work of the ONC with the private sector is rather unique for most government entities. However, in supporting private sectors to actually implement health information technology, they are able to reach many, many providers and clinics. And undoubtedly, one of the clinics that you will work in will, too, be touched by the work of the ONC. The ONC also has a very important program for all of us. It's titled Putting the Eye in Health IT. And this is a consumer-focused educational campaign that is designed to help people understand what health information technology is. And interestingly, it uses stories about the transformative power of the nation's shift to an electronic healthcare environment. So it's based in stories. You may run into this campaign as you're moving into your own fields in behavioral health. Now I'm going to offer a quick rundown of the promised 8 health information tools. So, tool number 1, medical practice management systems. These systems are responsible for all of the administrative and clerical parts of running a healthcare office. That includes managing documents, scheduling appointments, filing insurance claims, billing and payments, and generating reports. These tools are a godsend to those people working in the front office and back office because they automate and streamline many of those activities. Usually these tools do not include patients' data or medical data. However, we want to really recognize that these are just as important to keeping a clinic running and providing care as any other part of the system. Health information tool number 2, electronic medical records. This is simply a digital version of a patient's chart. All of the information that a particular clinic or health system has about a patient is included in the chart. That includes a medical history, diagnoses, and treatments. Unlike the big old fat paper folder that might have had most of this information, electronic medical records provide an organized digital way to access that information and keep it at your fingertips. It's also less likely that you're going to lose any of that information. For providers who use these tools in their clinics, it's easier to track patients over time, and they can do things like send reminders for appointments, vaccines, and preventive care. They also have all the information they need to provide better care to that patient as long as they're staying within that facility or that health system. And that's where health information technology tool number 3 starts to expand. Electronic health records. Again, like an electronic medical record, it is a digital version of a patient chart. However, the electronic health record provides a bigger picture of the patient's medical history than an EMR does. It can be shared with other authorized providers, so different healthcare providers can share important information. Many of today's EHRs integrate other types of health information technology, such as telehealth tools, e-prescribing, billing, and some of those clerical front office tasks. It's a quick, easy communication that's provided once data are entered into the electronic health record. This leads to streamlined sharing of updated real-time information. So for those who share the electronic health records, a patient can be seen in a behavioral health clinic, a primary clinic, and a cardiology clinic, and all of the providers have access to that information, and it can be updated in real time. They provide access to clinical decision tools that providers can use for decision making. And when embedding that patient's medical history into those clinical tools, the EHR can help to avoid medical errors, especially medication errors. They also include a complete medical history of the patient, not only in one clinic, but across multiple providers. So everyone can see all of the care that this patient is getting if they have access. So one confusing thing for many people is what's the difference between an electronic medical record versus an electronic health record? It's really very simple. In an electronic medical record, the patient's history, their medical history at one practice is recorded and kept. So it's just one bucket. An electronic health record is an overall report of a patient's health that can be shared among providers. The EHR is especially effective because it allows medical information to move with the patient to specialists, labs, imaging facilities, emergency rooms, pharmacies, and across state lines. So if you're working with a client whose information is recorded in an EHR and they show up at a participating emergency room, then those docs in the emergency room can get that access to that patient's EHR so they can provide the better care for them. Health information tool number 4, e-prescribing software. Again, something that's often integrated into the EHR. These tools allow electronic real-time prescribing to occur. Almost all providers are now required to use them, especially in the behavioral health realm. But the reason that they are so widely required is because there are many benefits. They reduce errors. They lead to faster processing of prescriptions, as the prescription can be ordered from the office before the patient even leaves. No lost or stolen prescriptions, which is especially helpful and important when prescribing controlled substances. Finally, it's easy for the pharmacist and physicians to see other medications, which reduces the risk of drug interactions. Another tool that you should keep your eyes out for, and you'll probably be using within the next few years, is remote patient monitoring. Remote patient monitoring, sometimes abbreviated RPM, uses digital technologies to gather medical and other health data from a patient who is at one location, then electronically transmit that information to healthcare providers in another location. These devices can collect all kinds of data, including blood pressure, weight, blood glucose, pulse rate, electrocardiogram results. So super useful in many environments. One of the first and early adopters of this was EMS. So EMTs could basically get all of this information, shoot it directly to the emergency department if they were bringing a patient in. But the use of these tools has increased dramatically during COVID with telehealth and other remote care being provided. And they're also becoming more and more important for paraprofessionals in the field to be able to track and work with patients. Health information tool number 6, the patient portal. A patient portal is the reverse of the doctor only having access to the medical record. It's a way for patients to actually access their own medical records and anything they need to know, any information that the doctor or the healthcare system has about these patients using a very simple personal device like a smartphone, tablet, or computer. Through a patient portal, users can schedule appointments, view their bills, and make payments. They can also send secure messages to providers, and in many instances, a patient portal will even include health education materials that are created and specifically uploaded to that patient to address a specific condition. They can sometimes have an online conversation with a healthcare professional. So this is a way for patients to actually access their own health records on their own, simply using those common devices. Healthcare tool number 7, referral software. Referral software is used to simplify and track referrals. And this allows systems to keep track of the different healthcare and other providers who care for each patient. A lot of systems are only used for healthcare referrals. So those referrals to behavioral, primary, dental, and other healthcare are generally handled by providers. However, some systems can be used to coordinate the range of services a patient might need, including social services such as housing, food assistance, transportation, and other essential needs. Those are things you might find yourself actually working to refer to. These tools are up and coming, they're growing better by the day, and they are really a powerful way to make sure that patients and clients are getting the referrals to the resources that they need. It's also very efficient for the paraprofessional or care coordinator to use them. Health information technology tool number 8, the health information exchange. Defined as the electronic movement of health-related information among organizations according to nationally recognized standards. The health information exchange allows everyone involved in a patient's care to see and electronically share the pertinent parts of a patient's medical records. Everybody doesn't get to see everything, but anybody who's providing care, if there's information they need to provide that care well, can get access to it. Health information exchanges improve speed, quality, safety, and decrease the cost of patient care. So they've been shown to really create a much better coordination of care, reduce use of unnecessary care, and they're a powerful way to collect data about what works and what doesn't. Most health information exchanges collect data from a variety of organizations across a region, and they assure that all of that information is shared appropriately with anybody in their network. At the national level, the ONC is working and continues to work to create a learning health system that compiles the information from multiple health information exchanges to assure that we've got really good data about what diseases are happening where, what treatments work. Obviously, the information is aggregated at that level, which basically means it is all pooled together without names or identifying information. But these tools are so powerful for us to really start to learn about the true evidence base in healthcare. Back to the individual, appropriate timely sharing of vital patient information can better inform decision-making at the point of care. So by sharing the information across multiple systems, there's an increase in, or a decrease in readmissions, decrease in medication errors, improved diagnoses, and a decrease in duplicate testing. So let's think for a minute about a short use case. Eric, made up name, made up person. This is an imaginary but somewhat typical patient. You are a peer support worker who's been working with Eric, a 32-year-old male with a diagnosis of bipolar disorder and a history of alcohol abuse. He has been managing his condition for the previous 6 months with the help of therapy, medications, and a strong natural support group. However, last week, his partner left him, moving out of their shared apartment. 2 days later, he lost his job. Depressed, he consumed a large amount of alcohol. His ex-partner found him the next day passed out in the bathroom of their apartment when she returned to collect some of her belongings. She called 911 and he was transported by EMS to the local hospital. After evaluation in the emergency department, he is transferred to an inpatient behavioral health facility for 2 weeks. So let's pause for a moment. You can pause the video if you'd like to. And think about how health information technology, any of the technologies we've just discussed, could help you as a peer support worker to support Eric better. So let's think about Eric, first of all, without digital tools. You're his peer support worker, and you don't really learn anything about Eric's crisis and his hospitalization until a week later when he doesn't show up for his appointment. Because there was nobody there to tell you, there was no way to quickly reach you. When you get into work, there might be a note in his record, but nobody's notified you that the note is there. With digital tools, shortly after Eric arrives at the ED, you receive a text message notifying you to check your secure portal about a patient in crisis. You log in and find out that Eric is in the emergency department. So you are able to follow up with him while he is at the residential treatment facility, to call his providers there. You can go visit and help him to contact his natural support system and set up an appointment with his provider. So when he leaves that residential treatment facility, he's not all alone and likely to get himself into crisis again. So let's pause for a moment to reflect on health tech. First, point your browser to http://www.openbeds.net. You can pause the video while you get there. Take a moment to cruise around the site and look at the services that this site provides. How could this resource help patients get the care they need more efficiently? What problems might arise when using this platform? If you're with someone else, take a few moments to discuss, reflect, or write some of your thoughts in response to this question. When you're done, point your browser to another website, https://crosstx.com. Take a few moments, of course pause the video, to surf this website, look at their products, look at their outcomes, look at everything that they offer. Now let's pause and reflect. How could this resource help patients get the care they need more efficiently? What problems might arise when using this platform? Again, pause for a moment to discuss, reflect, and/or write down a few ideas. Here's a summary of what we've just discussed. Just as technology has changed your life, it has changed the way that healthcare is delivered. Health information technology is the electronic systems that healthcare professionals and increasingly patients use to store, share, and analyze health information. Used appropriately, health information technology has the potential to improve quality and timeliness of care, increase care coordination, improve health outcomes, reduce costs, and increase patient satisfaction. Many types of health information technology are used in the behavioral health workplace. 8 common types that we've discussed are medical practice management software, electronic medical records, electronic health records, e-prescribing software, remote patient monitoring, patient portals, referral software, and health information exchanges. This program is brought to you by the Grow Our Behavioral Health Workforce program, which is a project of the Center for Health Innovation, with funding from the Health Resources and Services Administration.